Right. Hello, everyone. So Joni and I worked together to create this infographic poster about trauma and just treating trauma. Throughout this semester, we've gone through just kind of what trauma is. We've talked about crisis situations. We've talked about suicide. We've just done a pretty in-depth, but also like large umbrella of just what trauma is and how we treat it. And this is super important as counselors. Joni is wanting to be a school counselor. I'm wanting to be a mental health counselor. So there's a little bit of differences, but no matter what, talking about trauma is just very important. It's something that, people we're bound to hear as counselors. People experience trauma. And so just understanding like how to identify it, what to do, and just understanding the differences is really important. And so that's kind of the information that we put on this infographic today. And so while we won't go, in depth on all of these categories just for time, we will kind of like briefly overview just, our thoughts on it and just, yeah, how we plan to use this information going forward in our careers. So, yeah, so just briefly talking about just kind of what intrigues me the most about trauma. And so in this first section, we have what is trauma. And so I think it's really important to note that trauma affects people in so many different ways. And so we have listed here neurobiological lens, the psychological lens, and the spiritual lens. When people go through trauma, I think each of these categories can mean different things to the client, and it can just impact them in different ways. And so what's most intriguing to me is the neurobiological lens. I think, yes, trauma impacts our feelings and impacts emotions so heavily, but it also impacts functioning. It impacts how clients live their lives. It impacts how they, if they're in fight or flight, they're like new learned behaviors, trauma responses, nightmares. Like there's just so much going on in their brain. Trauma can definitely impact our brain structure and function. And so, yeah, just understanding that we need to help clients regulate this. It's not just talking about their feelings. It's not just trying to get them to move past it, but I mean, their brain functioning is different. And so I think that's most intriguing to me. And as I go through my career, just understanding this on a deep level, not every client is going to respond to the same type of treatment. It impacts everyone's brains very differently. And so, going through the theories next, I think trauma-focused cognitive behavioral therapy is something that I just not identify with, but something it really intrigues me. It's my preferred approach. And again, every client is different, but I think just yeah, dealing with trauma symptoms is very hard for the client, especially, as their daily living is just impacted so heavily. And so working through a theory like this, especially when working with adults, I know Joni may work more with children and she can talk more about those other two, but for me, that cognitive behavioral therapy approach, I think can be very effective when I consider, that neurobiological lens, but again, just being flexible. And so, yeah, just that importance of being trauma informed, as we consider, that neurobiological lens as well as those other two lenses, and then also those theories, just being able to be prepared and being trauma informed, being prepared and being equipped to help our clients. We want them to feel safe. We want them to trust us. They went through a traumatic experience in their life. There's a lot of, mistrust that can come from that. But not only that, we really want to help them in the best way possible. Our interventions that we're using, are those appropriate? Are those good for the client? And yeah, we want to be able to work together with them. Therapy, I feel like can be very ineffective when we're not working with our client. And so, if we give that safe, welcome, trusting environment, I think that can really, as it's listed there, encourage collaboration. And so, yeah, while trauma can just be so many different things, just understanding, how to handle trauma. And even if we don't know every detail about the specific trauma we're dealing with, just, being in general trauma informed, and just understanding, what effects that can have on the client, and how we plan to go about that, I think can be really, really important. And so, yeah, I'll kind of pass it off to Joni to kind of talk a little bit more about, just being more trauma informed as well as, how she envisions, this in her career.
Okay, hi. I'm going to talk to you guys a little bit about treating trauma as a school counselor. A lot of the students that I work with have experienced a great deal of trauma in their lives. So I feel like this is really important information. And as I was kind of tackling the assignment, that was one thing that I kept coming back to is how will I use this in my practice? And so a couple of the pieces that really stood out to me as being important, just looking at that lens of what trauma is, I kind of went back and forth between the neurobiological lens and the psychological lens, and how important it is to understand that trauma impacts how our brain functions. This is something that I've been working as a school counselor for the last couple of years on an emergency license. And last school year, I really started to try to teach the students that I work with just some basic information. I work K through 5, so basic information about how our brain works and information regarding how our brain works differently when we've experienced some trauma, when we are having some heightened emotions. I feel like that information is really powerful for students to know and understand. If you kind of have an idea as to what's going on in your brain, you are better able to address and manage those symptoms. And so then kind of partnering off of that, the cognitive behavioral therapy goes really well with that understanding of how our brain operates. And so I found that to be really helpful with students. Cognitive behavioral therapy really operates on the idea that the way that we think impacts the way that we feel, and that impacts the way that we behave. In the school counseling realm, those student behaviors tend to be the biggest thing that lands a student in my office. The teachers are concerned because of the behavior students are exhibiting. And so I have found cognitive behavioral therapy to be really helpful in addressing those symptoms that the teachers are seeing, and then kind of tying back in those different lenses. Kind of thinking about some of the different approaches that were discussed throughout this reading. One thing that really stood out to me that could be really interesting to utilize within the school counseling realm is that trauma sensitive yoga. I just know personally and professionally how like our physical health, our physical well-being impacts our mental well-being. Um, and just some basic movement can really help us start to feel good. So when I was reading the articles about the trauma sensitive yoga, this was something that really stood out to me as like kind of questioning, like, could I fit that in somehow? What would that look like? And then just thinking about some of my students that might really benefit. Um, I know that whether um, I know that trauma is a super important topic for mental health professionals, whether you're a school counselor or working in a clinical setting. I also know that trauma is something that is ever changing. And so knowing that information paired with the importance of understanding trauma, I want to continue to participate in like workshops and continuing ed to learn new things about trauma, new interventions. I strive to create a safe environment for my students by using trauma sensitive language and build trusting relationships. Those trusting relationships in the end are going to be essential to helping students overcome trauma, even helping adults overcome trauma. Oftentimes, trauma is something significant that has happened that the client is struggling with trusting others. And so being that person for our clients can really have a big impact on them addressing the symptom of their trauma. Hopefully, through reviewing and our conversation today, you have a better insight as to what trauma is and how we can treat trauma in our practices, whether that is a clinical setting or the school counseling realm. Thank you very much. Were we at 10, do you think?